The story of HIV in America is a tale of heartbreak, resilience, innovation, and hope. It begins in the early 1980s, a time when a mysterious and deadly illness began claiming lives, mostly among young gay men. This illness, which would later be known as HIV or AIDS, quickly became one of the most significant public health challenges of the 20th century. In 1981, the Centers for Disease Control and Prevention, CDC, reported the first cases of what would later be identified as AIDS. These early reports sparked fear and confusion. By 1984, researchers had identified HIV, human immunodeficiency virus, as the cause of AIDS, but misinformation and stigma were rampant. People living with HIV faced discrimination and social ostracism. The gay community, in particular, bore the brunt of the epidemic, with thousands of lives lost and countless more affected. As the epidemic grew, so did the activism and advocacy. Organizations like ACT UP AIDS Coalition to Unleash Power and individuals such as Ryan White and Magic Johnson brought national attention to the crisis. Their efforts helped to humanize those living with HIV and pushed for faster research and more compassionate healthcare policies. The turn of the century brought significant advancements in both treatment and prevention. Highly active antiretroviral therapy (HAART) became the standard, drastically reducing AIDS-related deaths and improving the quality of life for those living with HIV. The introduction of pre-exposure prophylaxis PrEP provided a powerful tool for preventing HIV transmission. Despite these advancements, challenges remained. The epidemic continued to disproportionately affect marginalized communities, including Black or African American and Hispanic, Latino populations, and people who inject drugs. Stigma and discrimination persisted, creating barriers to testing and treatment. In recent years, the U.S. government has launched ambitious initiatives aimed at ending the HIV epidemic. The Ending the HIV Epidemic, a plan for America, aims to reduce new HIV infections by 90% by 2030. This plan focuses on diagnosing, treating, preventing, and responding to HIV, with a strong emphasis on reaching communities most affected by the virus. The narrative of HIV in America is one of incredible progress, driven by the resilience of those affected by the virus and the tireless efforts of advocates, researchers, and healthcare providers. While challenges remain, the path forward is one of hope. With continued dedication and innovation, the goal of ending the HIV epidemic in America is within reach. This story, marked by both struggle and triumph, serves as a testament to the power of human determination and compassion.